Hello, my friends. This is the new one of our frames related to MRCS examinations. Hello, everyone. I'm Dr. Hamza Al-Ashwah, and today we will to discuss about the frame to examine the breast examinations in MRCS. Okay. Firstly, we have our frame as we said before. We have to, after introducing the room, wash the hand and introduce yourself and confirm the patient details, explain the examinations and gain the consent, and also exposure and ask for the chaperone, ask about the pain and also the position in this case, which is important, and go for inspections by details and palpations, and finally don't forget to thank the patient and wash your hands again. To discuss by details, you have to wash your hands, introduce yourself. Hello, my name is Dr. Hamza. Um, could you please confirm your name and age for me? And also try to explain the examinations and gain the consent. Today I have been asked to examine your swelling in your breast, both breast, which including looking and also feeling around it and doing some special tests. Was that okay with you to gain the consent? Okay. After that, you have to ask about the exposure. You have to be naked of your chest and abdomen to be available for the examination, okay, and the examiner with you as a chaperone, okay. And before you start your examinations, don't forget to ask about the pain. Do you feel any pain at the moments? And ask the patient for the position, which is important in this case, okay. um, and after that, the position of the patient in supine, lie down, and the right hand below your head, okay. To examine the right breast, you have to ask the patient put the right hand below below the head of the patient, okay. We go for inspections by asking the patients in three positions. The first one, the hands resting on the side, the hands resting on the side, and look for the 6S of any swelling. Look for erythema, put orange, and also the nipple changes. And the second positions, the hands on hips, and the third one, the hands behind head. We have to go for the palpations and also start firstly by the asymptomatic one, then the other one, going for the palpations by this way that that we say it, that you say it, okay. This way, start from this points, and dot it like this, and go preferably like we draw it, okay. And then if there is masses, you have to palpate for temperature, tenderness, and size, and surface, and edge, and the consistency, mobility, pulsatility for any swelling as any swelling. And don't forget to palpate the axillary tail. Don't forget to palpate the nipple by asking the patient to squeeze it for any bleeding or any changes. And don't forget for palpations, the most important one, which is lymph node, the axillary lymph nodes and the regional lymph nodes, which is infraclavicular, supraclavicular, and cervical lymph nodes. Finally, you have to thank the patient. Thank you for letting me examine you. Do you need any help? And thanks for all. And go for your examiner and wash your hands and try to present your case. That's all about the breath examinations frame to get more marks in the